Hello everybody, my name is Dr. Michael Cady. I'm one of the OBGYNs here in Crosby. I'm part of the OBGYN team and have been here since 2004. So January is Cervical Cancer Awareness Month, and so I thought it would be a good opportunity for me to talk to you about ways that we can help you reduce the risk of you developing cervical cancer. So a little bit of history. In the 1950s, they developed the Pap smear, and by the early 1980s, the incidence of cervical cancer had already decreased about 70%. So it's been excellent screening tool for us as physicians and care providers to reduce a woman's risk of cervical cancer. Unfortunately, in the world, it's the #1 female cancer, mainly just because a lot of women, especially in third world countries, don't have access to healthcare and screening Pap smears, which then ultimately leads to them developing cervical cancer. Fortunately, here in the United States, where most women do have access to healthcare, the incidence of cervical cancer has dropped dramatically. It's still too high. About 13,000 women develop cervical cancer each year in the United States, but it's markedly lower now than it used to be. So when the Pap smear first came out in the 1950s, basically it entailed just looking at the cells underneath the microscope and seeing if the cells looked abnormal or not. Since that time, we have come to understand much more about cervical cancer, and mainly what we've come to understand is that cervical cancer, over 99% of the time, is due to a virus that is sexually transmitted, and that virus is called the human papillomavirus. So cervical cancer is unique in that almost all cervical cancer is connected to this virus. Unlike other cancers, which tend to be due to spontaneous mutations or sometimes due to inherited gene mutations, cervical cancer is almost always due to acquiring the human papillomavirus. So now when we screen for cervical cancer and do the Pap smear, in addition to looking underneath the microscope, having the pathologist look under the microscope for abnormal cells, we're also testing to see if women have the human papillomavirus. Many of you may remember that screening we used to recommend starting at the onset of intercourse, but the guidelines have recently changed. And so now what we're recommending is once a woman turns 21, we should start screening for cervical cancer with the use of Pap smears. The screening interval also has increased, so it used to be every year, and now for women aged 21 to 29, we're recommending screening every 3 years. And then from age 30 to age 64, we're recommending screening every 5 years, and that's assuming that the test comes back normal. If it comes back abnormal, we contact our patients, have them come in for further follow-up. So in addition to the Pap smear, we have another great tool to reduce a woman's risk of developing cervical cancer, and that's the human papillomavirus vaccine. The vaccine is called Gardasil, and it vaccinates against 9 of the most common viral serotypes that cause cervical cancer. So human papillomavirus has many different types. They're all human papillomavirus, but there's subtle differences, and we actually number each one. So what we've learned is that types 16 and 18 are found in 70% of women who have cervical cancer. And then there's another 7 viral serotypes that account for 20%. So all of those 9 serotypes are included in the Gardasil vaccination. So just by receiving the vaccine, it can reduce a woman's risk of developing cervical cancer significantly, because that will prevent 90% of the viruses that cause cervical cancer from infecting that patient. Because it's not 100%, we do still recommend that women who receive the vaccine continue to go in for their Pap smears. The Gardasil vaccination series is a 3-part series, meaning that once you receive your first, we recommend that you come back in 2 months and then in 6 months to complete the vaccination series. So this is just a brief summary of what we can provide to our patients to help reduce their risk of developing cervical cancer in the future. I hope this was helpful, and be sure to contact us if you would like to schedule an appointment. Well, thank you for listening, and I hope you found this information helpful.